product because it's all things flexible and all things adaptable. We'll call him Spider because he's all those things for sure. And so really quickly to get into the work that the health and housing work group does, we came together. You saw one of the slides on November 2022. We got together in a cohort and we figured out, and we had these great slides. Thank you, Heidi, for putting this together, because we had all these great slides and post boards and postmarks, etc. What do we want to see, and what do we want to focus on as a health and housing work group? And so we took all of that information, organized it into 4 different categories: homelessness, affordability, intersectionality with other SDOH, and other topics and priorities. We took all that information and we decided to filter it and silo, and we asked all of our work groups, which ones do we want to focus on? And we sorry about all the ones, so we're not focusing on all of them. But the number one that we are focusing on is the one kind of shaded in the gray: the screening tools for housing, safety, and quality. That's the one that the work group decided to focus on: the screening tools for housing, safety, and quality. And so the next step is for the work group, for Kinder, for all of us to come together to develop a survey. We had a subgroup to kind of work on and create what that survey looks like, so that we can share it with all of the varying different tenants. Well, what does your housing quality situation look like? And so the goal is to wrap that up, filter out the survey, share it once Kinder has enough funding to do so, so that we can receive that analysis and go for next steps. So that's essentially what our work group is about. Our work group is doing, and it's all because I have super friends like Heidi and Dan to help me out.
If you want to join these superheroes, feel free to reach out to them. We are always looking for folks to join these work groups.
Do you remember what it was like to be a teenager? Do you ever look back at your life and think, what was it like to be a teenager? I don't know what your life was like, but mine was chaotic. It was challenging. It was confusing. My family life was falling apart. My mom was drowning in alcohol. My father, of his business of 30 years, lost his job and got taken over in a corporate takeover. Their marriage was disintegrating. But I had the good fortune to get out of that house when I was 15. I went away to school, for high school, 2 states away, but I landed in an institution that academically was way over my head, socially way over my head. I was getting up at 6 in the morning. I was going to bed at 12 at night. We went to school 6 days a week. The pressure was unbelievable. And I was caught between this dynamic of this family falling apart and this institution that was trying to shape me into a leader of the next generation, right? And when I get really compressed like that, I can't eat. I get stressed, I can't eat, and I dropped weight. If you see this body, I was 20 pounds lighter. That's where I was at age 16. I thought I was going to be 6 feet under, not just 6 feet under, by 12 feet under by the time that semester ended. So I got myself home and I rode my bike to my lifelong family doctor and said, I need help with my stomach. I can't eat. I'm dropping weight. He never examined me. He looked at me. He pulled out one of those white pads, RX pads, where you write the prescription, scribbled something, looked me straight in the eye and said, there's nothing wrong with you. Maybe you're crazy like your mother. He handed me the piece of paper and I read it. He walked out the door. It said, take Maalox twice a day. And that was the solution that I had for my life. I rode my bike home and I talked to my parents that night about what happened. My mother was absolutely livid. And it turns out that 7 years before I was born, she had multiple suicide attempts and was hospitalized for quite a long period of time because I couldn't figure out what was going on with her. She had a genius IQ, high functioning genius IQ. And I don't have time to tell that story today, but if you know the story of A Beautiful Mind, you know the story of my mom. And so that day in the doctor's office, I got a really bitter pill called stigma. But I also realized that I was the kid of the crazy lady in town, and I didn't know that the stigma, that I was facing stigma every single day of my life until that doctor gave me that prescription. And so, oops, I went the wrong way. My name is Suzanne Jarvis. I'm with the Houston Recovery Center. I'm the Chief Analytics and Communications Officer there who specializes in addiction recovery. And I brought this story to our workbook, the work group, when we first started. And what was amazing that day was one by one, every other person started telling their story. We've all been touched by mental health. We've all been touched by substance use. And so that day we gave birth to giving voice to the untold story. The work group started out, Network Behavioral Health Providers initiated this. They are a partner. And Sangha was the former executive director. She brought on Alejandra Posada with Mental Health America, and she said, I've got the mental health corner, but we need someone in the substance use arena because mental health and substance use are two completely different conditions. And so we gave the work group a really sexy name, Mental Health and Substance Use Work Group, because substance use is buried. It's buried in service delivery, it's buried in policy, it's buried in funding streams. No one wants to look at it. We created this vision to give voice and alignment to mental health and substance use to improve health equity through education, advocacy, and research. Alejandra, the other thing that we did, we polled our work group members to find out their priorities. And guess what the #1 priority was of the response? Stigma. How many times have you heard it today? So giving voice to the untold story of stigma. Alejandra stepped down and we have a rock star and he's here today, Dr. Stanley Williams. And he was speaking, one working with you. And when he came, the party really started. Do you see that big lived experience? Well, if you ever hear Dr. Williams talk, you will always hear the lived experience of the people that we're serving. And you see stigmas up there, and you see journey map, and you saw a journey map of the community health workers today. He brought that into existence. He also brought Chick-fil-A's video on the corporate decided to educate their workers on empathy and using the untold story of the customers that came for their dinner and lunch. And so we align mental health and substance use across a collective, but we also are working with special projects in the community. But the whole basis of it is co-creation. We can't do it alone. We can only do it together. If we don't talk about it, we can't normalize it. If we can't normalize it, we can't find the solutions. And the solutions really are giving voice to the untold story of stigma. Thank you so much. No. Look at these guys down in the corner. They are not in the corner. They are part of this in such a big way. So yes, rock stars. I didn't push far enough. So anyway, I just have to say one thing. Heidi shows up to the party and she says, I'm doing research on stigma. And Shrila keeps us in line with all of these frameworks and everything we're doing. But what came out of here was research merging journey maps and stigma. It's at the IRB. We've got community partners. I can't wait to see what the outcome is. So thank you for all your service to us. That's all.
This comes from Black and I wasn't paying attention. So I'm William Lyons. I work at Legacy Community Health. I am Senior Manager of Programs for our Health Connect program. And we try our best to address social determinants of health concerns for our patient population. I also am a co-chair of the Community Voice along with Sean Haley, sorry. And so I really came to the work group because I had been involved in its inception. I had my own experience of being a receiver of healthcare and recognizing many times my voice and the voice of my peers not being recognized in the space. So I remember being an activist on my college campus and us organizing, us doing snowball research tools to gather our voices of other queer people on campus and presenting them to our faculty, to our healthcare institution, our resource centers, and being told, oh, thanks, but we're already doing the best we can, or aren't you happy with what we are doing? And being told so often that our voices didn't matter and that we didn't have a place at the table. And so being a young person, being a young queer Black person in that space, it's really challenging to be told by all these older white people about how I should be grateful for what I'm receiving today. And so I bring that to this work, recognizing that many people who I serve now are in that same situation where they're coming to us, they're new to the US, our new neighbors, they are historically marginalized, and we don't have a space at our decision-making table for them and their voices. And so the problem we are trying to solve is how do we work towards a broader range of these underrepresented voices at our decision-making tables, our policy-making tables. And so our work as a collective is trying to gather us together and who's doing this work right now, who's doing this really well, and how can we learn from you, and how can we work towards universalizing this experience for all our institutions. So not just Legacy doing this well, not just HEC Health doing this well, but all of us doing this well, so we all can make a collective impact to our community here in the Harris County region. So in 2018, Legacy launches our first social determinant health program under Felicia Latson. We were really trying to go upstream, right? So we're used to doing, putting out fires, and we're like, let's not put out fires, let's get rid of these dry leaves. What can we do with the infrastructure? So that was our vision of going into this work. And so in 2020, there was a call to action. And if you look at the roster for work groups, Legacy had 1 or 2 people from ourselves in every work group they had. And we were just ready to do the work and being our best stewards of information and sharing. So as a work group for Community Voice, we had 3 main goals when we came together. So we were looking to figure out how do we leverage the existing work that's already been done. How do we create like a quick list of resources? So really thinking about, I'm a busy person. I don't have time to read all the literature on this. Give me the quick fact so I can work to implement this quickly. And then how do we identify gaps, right? So even if I'm doing the work the best I can, there might be some notable gaps that might be a quick fix I can address. And what have we achieved? So we've been, I laugh because we spent like a whole 6 to 9 months trying to even define what is community voice, what is community engagement. We had subgroups working on these definitions because how can you work to address the problem if you haven't defined the problem? So we worked really hard to kind of even come up with a collective definition. We've also developed a matrix of engagement activities. So if we are working towards community voice, how are we engaging in the community? What strategies are we doing? What activities are we doing? We have participated in asset mapping. So who in our region is doing the work best and who stands out, and really learning from them about how we can be better at this work. And then lastly, what we've engaged in is, it's called the DASH grant. I'm here for that. So but the belief behind it is going into the community, hearing from them, how do you access information about healthcare? How do you access information about social resources that you need? And hearing from the community how they do that. And what we've learned from that is a lot of word of mouth. So they have an expert in their community who is sharing those resources and information to the broader collective. So if that one person doesn't know about your resource fair or this free screening opportunity, that whole community is left out. And so it really encourages us to be engaged with the community so we know that we're meeting the needs of that community. Where are we going? So right now we're looking at a few frameworks. We're looking to develop a toolkit that is collective of all those different frameworks. A lot of that's grounded in research, but we want to be dynamic and recognizing that sometimes I don't have a research opportunity. Sometimes I just want to be a good neighbor to this community. And so how do you do that in a respectful, culturally community way? We are expanding on the DASH grant. So we started in East End and Third Ward, and we're looking to go to other regions in our Harris County area. I think the next group is centered for Fort Lee County as well. So how do we learn from different communities, different neighborhoods, so that we are dynamic in this work? So what works in Third Ward may not work in Fort Bend. So how do we listen to Fort Bend and figure out how they access information differently than they may in Third Ward? And then we're always looking for glimmers. So these are opportunities where unless you show up and hear the story, you don't know about it. So sometimes it's a community leader who's sharing a highlight from, what they're doing in the community. Sometimes it's a community organization highlighting what they're doing. And so we're always looking for opportunities to kind of celebrate the small wins towards greater success.
And I have something in each hand. It's gonna be hard. Okay, hi, I'm Rosalie Herrero. I am Director of Vulnerable Populations at the New Texas Epidemic Public Health Institute at the School of Public Health. I am a community health worker geek and instructor. That's actually my Twitter handle, CHW Geek at Twitter X. I think it's like Latin X now. So Dia de los Muertos is today. So yes, I think about your loved ones who've passed, everyone who's passed. We have an ofrenda here today. If you haven't seen it, please pass by. This is the ofrenda at my mom's house. They say that we're gonna have the worst voter turnout ever in Houston. Please, let's prove them wrong. There are over a dozen policies. We talk about policies today. There are over a dozen policies. Please, please, let's go out and vote. Take someone with you. Take a couple of people with you, please. Community health workers, then that's about as far as I could go back on my Facebook page. This is 2014. Shout out to all the community health workers. Here you see, whenever I see this, and it was great. And that's why it took me so long to do this presentation, because I was like going through all these pictures, just really celebrating. Here you see joy, people through challenge, self-determination. At this time, people were asking, what's a community health worker? Some people still ask that, but nobody asks that better than Heidi and Trila, because they still ask me every day, which is great, and they really listen. And I'll also give out a shout out. I'm happy to see Ron. When I came into town, Gateway to Care was health equity 1.1, 1.0, it really was. Everyone's trying to come together with a community health worker model to make a difference here in Houston. Community health workers, someone mentioned that Texas is a leader in community health workers. It's actually true. We're #1 as opposed to 50, which is great. And we need a certification at the beginning of this year, but it's really growing. At the beginning of this year, there were about 4,000 community health workers certified in the state of Texas. Of course, there's tens of thousands of people working as community health workers. As of September 30th, there are 6,000 certified community health workers in the state of Texas. Over half of them are here in the Gulf Coast region. Okay, so a big difference. This is a picture of course, the Community Health Worker Advisory Committee at the state level, because since we're certified, there's actually at DSHS, there's a Community Health Worker Advisory Group. They meet every quarter. Many of us have served on that advisory group. Here we go. Dia de la Mujer Latina. Shout out, of course, community health workers coming together. seeking knowledge, education, so they can share with the rest of their community. Pandemic did a number on us, but community health workers, when everyone was running home to work from home, community health workers were knocking on the doors, seeking out their clients and patients, seeing if they were okay, really beating back a lot of misinformation and disinformation. Real difficult time, but we got through it and we came back. And now this is one of the first conferences that happened at U of H right after the pandemic, and it really showed community health workers really wanted to come back together and just growing stronger every day. And we love to be partnering with the Health Equity Collective and really moving forward. Heidi mentioned it a little earlier. Two bills have passed that will reimburse community health worker work. First time ever. It's a step, and it's the right step in the right direction. So that's always been a problem. How do we fund our community health workers? We love them. How can we keep them on the payroll? And policy and laws being enacted like this is definitely a first step. And you see this picture before, people coming together, allies, community health workers, really talking about the ecosystem. That's why I like working alongside with the Health Equity Collective, because we're really talking about not only developing community health workers and them developing themselves, which is always great, but developing systems, talking about systems change to make a better ecosystem for community health workers, because it's not just about pay and funding, but having community health workers really feel welcome within our institutions. So appreciate that. And what we're gonna hear now is a specific example of how community health workers work within our institutions. Give it over to my dad.
Good morning, everyone. My name is Mayana Monteyo. I'm a wellness advocate manager and a community health worker instructor. Also a community health worker. I work with Community Health Choice, and I lead a team in the wellness department at Community Health Choice. Community Health Choice has been a member of the Health Equity Collective from very beginning. I even helped launch the community and communication work group. However, my team is kind of new. It's my first time coming, so I'm so excited, and it's nice to hear everything that everybody has shared. So we share the same mission and many overlapping priorities. We believe in the CHW model for delivering individualized support and resources that our members need to be as healthy as possible. The Health Equity provides us with opportunity to form new partnerships, collaborate external stakeholders, and strengthen the greater Houston area of the CHW network. My team mainly focus on better health outcomes, creating work environment with CHWs that can thrive, mobility with CHWs within the organization, offer promotion opportunities to grow within the role, and develop additional CHWs role. Another thing that Rosalie was touching is training and professional development opportunities. That's a big thing that we have currently in working with our CHWs. Here's some top 3 members SEOH needs. I know we're running a little bit of time, so I won't go through all of them, but this is mainly some of the percentage that we have from our Community Health Choice annual report in 2023. So our Community Health Choice make a big impact, and they make sure they collaborate, they care coordinate with our members in this social recognition needs. Some of our achievements that we have done, we created a new CHW supervisor role recently. So that's a win for us. We have a really competitive CHW salary, and we have partnered with other organizations for CHW capacity building and training. Where are we going? We're going to be expanding our CHWs to the field. So that means more work opportunity as well. And we're gonna continue strengthening our internal CHW. My CHW group is just one of them, but we have other two groups in the organization, so really hoping we're gonna expand that. This couldn't happen without my leaders believing in the CHW, so I have to give kudos to them for that support. And that's the end of my presentation.
We just have a round of applause for our local leaders. So actually, Community Health Voice is going to be part of our early adopter learning cohort for the community health. So thank you so much for sharing. And without further ado, I want to introduce Dr. Cynthia Osborne. She's the founder and executive director of the National Prenatal to 3 Policy Impact Center, home of the 50-state Prenatal to 3 State Policy Roadmap and the Prenatal to 3 Policy Clearinghouse. She left us from Texas and joined the faculty at Vanderbilt University. And previously, she was faculty at LBJ School of Public Affairs at the University of Texas at Austin for 16 years and did incredible work on maternal health and policy in this space, and served as the Associate Dean for Academic Strategies for the last 3.5 years. She's here on a lectureship event. We'll share a little bit about that in a minute. But when I told her you're going to have the Health Equity Quarterly meeting, and we'd love for you to be there and talk about, what does it look like from local to national, and share her thoughts. She was like, yes, I'm there. So thank you so much, Dr. Osborne.
Well, thank you for the opportunity to be here. And I'm just gonna speak for a few seconds because I know you probably have questions among the group. And I have learned so much by listening to what all of you have shared and more about the Health Equity Collective this morning. So thank you for that opportunity. And although I have left Texas physically, my heart is still here. I've moved to Tennessee. I only went to the state so but what I'm hearing today is so important. The work that we do at the Prenatal to 3 Policy Impact Center, also a fan of very long names, is to be a resource for state policy leaders, administrators, and advocates as they look to implement effective policies that actually help children thrive from the start. And the reason that we focus on the earliest years is because we know how important those earliest years are for healthy brain and body development and really set the stage for subsequent health and well-being. But we don't just focus on those earliest years as if there are specific policies that help babies. And what I mean by that is when we first got started, the folks who were funding us, who we were talking about some of our new ideas of, we want to create this roadmap that's going to identify what the effective policies are that help children thrive from the start. They thought that we would come back with things like, well, we'll do something like Family Connects or child care subsidies, maybe early Head Start. And we said, well, yeah, and Medicaid expansion and paid family leave and earned income tax credits and minimum wages. And that was somewhat of a surprise to folks who focus on early childhood to think about maternal health, parental health in general, that there's nothing that we can do for our littlest ones without caring for those who are caring for them. And that now seems to be pretty widely understood, but our fields have been so siloed of whether you focus on health or housing or early childhood or climate. And to see this coming together in this collective is so important. I think the second thing that I'm really loving about this is, we focus on the big P policies, the things that states can implement. Sometimes they're federal policies that states get to make rules about, like SNAP administration or early Head Start or early intervention services.
But other times, there are big P policies that states have sole authority to create, like a paid family leave program. But that is, just the beginning. That I spend so much time doing is to talking with communities and state leaders to really understand, how are you implementing this? How are you making sure that families are actually accessing the services? I found the information about prescriptions so informative, because that's the same for SNAP, maybe not the same level, but there's families out there who are eligible for SNAP and WIC who don't know that there are home visiting services in their community and so forth. And so really working at that level and including the voice of those who you are trying to be in service of, to work with them, that's how we actually make these big P policies effective on the ground. So I've just really appreciated to hear this effort. And then the third thing that I'll end with is this focus on the workforce to strengthen. In this case, you're talking about community health workers, but I tell you, home visitors, childcare providers, you name it, those we're trying to serve, our families are often just, there was a quote here, one paycheck away from being the beneficiary of many of the services that we're trying to offer. And we've done a lot of work on childcare providers and a lot of work on home visitors, and I'm excited to learn more about what you have done, these mapping these pathways for community health workers, because those who go into these roles are there because they want to serve, but we can't ask them to carry the weight of all of us because they have a big heart. They also need respect and a pathway of their career and a paycheck that really is commensurate with the skills that they are bringing and the value that they're adding to the community. And so I'm excited to learn more about what you've done in that role, because again, we can talk about the big P policies all day long, and they are important. In Texas needs some help, so does Tennessee, so vote. But it is at the end of the day that intersection of the little P policies, how things are actually implemented, that makes such a difference. And to just reiterate one other thing, this is the Health Equity Collective. And like I said, when we first started, our idea was, how do we ensure that all children thrive from the start? And some of our funders were interested in school readiness, which is a term I'd like to have a conversation about at some point too. The idea that kids are supposed to be ready for school. Kids are supposed to be kids, and schools are supposed to be ready for them. But if we talk about school readiness, right, that was kind of the idea. We're going to do all this work in the earliest years so we can ship them off to an institution that is going to care for them then separately for the next 15 years. And that framework, again, I'm now in a college of education and human development, and there's so much that folks want me to come back to. Yeah, but what about the schools? Well, what about the schools? And I'm a former teacher. I taught 6th grade. And there is a special place for people who teach in middle schools, either in heaven or maybe not, but it was the most rewarding job I ever had. And I was pretty convinced that schools were it. That was what helped me on my path to success. And I learned really quickly that although schools are so important, of course they're important, and all the teachers want to be that stand and deliver sort of teacher, that what was happening in my my students, families, and their communities, what they were experiencing before they would come to school that day and when they left that afternoon, had such a greater impact on whether they were interested in learning about osteoblithocines, whatever those are, the early humans that I had to teach them about in sixth grade. That wasn't really the thing that they were what was motivating them. And so my whole career after that is to move upstream and to see how it is that we can ensure that children get off to a healthy start. And those same policies, either big P or little p, that help those sixth graders, that help those kids who are entering kindergarten, or that help the moms during the prenatal period, and the babies shortly after birth, they're all here in this room and they're all the same. And the key is that we're centering the family in the middle and thinking about the broad-based economic and family supports that they need, as well as the targeted interventions that we can provide to address their specific needs. And that's what allows families to be healthy. And if breaking down these silos like you are, is so heartwarming for me to witness. And I look forward to following what you're doing and learning from you and sharing. I always love to share good things out of Texas, and trust me, I find a lot of them. I do share a lot of good things out of Texas, and sharing with others across the country so that they can replicate what you're doing here. So thank you for the opportunity to be here.
We have time for a couple of questions. Does anybody have any questions for the panelists? Want to make sure also everybody leaves on time. And any questions for the panelists? Yeah, thank you.
I think it's safe to say that everyone wants to do great things for the community. But how, or do you have lessons learned about how you can't, you have to focus on certain issues first? You can't boil the ocean and solve every issue that you want to solve at one time. Do you have any lessons learned about, okay, this is where we start, demonstrate value, and expand our scope, as opposed to just trying to, like I said, boil the ocean and solve everything at once? It wasn't pretty easy.
Thank you. So I definitely believe in the community will let us know what they have capacity for. So I remember working to, I've been with my role within legacy, we've been working on this climate change for the community, kind of greater north side area. And so just recognize we have a lot of grandiose ideas of what we could do, talking about planting trees, talking about solar power, farms in the community and stuff like that. But recognizing that some of the community was impacted by Hurricane Harvey, and their homes are still not repaired. And so we're going in there trying to do all this infrastructure work, and we got existing homes that need repaired. So that's where we started. So we're working with them to help being sure that they have a safe place to sleep at night. And, with Texas weather the way it is, you never know when there might be a freeze or a hurricane. So we really are trying to work with them to ensure that they have that infrastructure first, to then build upon that to the other resiliency type work. And so I think that's a great example of that. And so organization right now that's doing that work, it's SEER, so Coalition for Environment, Equity, and Resilience. They're doing great work in the community to address those, where are people at today, but then building tomorrow.
Anybody else want to?
Jump in really quick. Stigma's huge, right? There's so many aspects of stigma. Right now, we're focusing mainly on stripping the stigmatic language out of how we talk about substance use and mental health. And we have to start there and educate people, and then we'll just keep going.
Really quick, correct, you can't boil the ocean all at the same time. In one of my slides I had earlier, it was really hard for the health and housing work group to figure out how do you get all those post-its and how do you filter them down. And once we identified five of the top research topics and opportunities we wanted to go after, well, how do you identify the one? And so it was really figure out, okay, well, starting with the point of, listen, we're gonna start with one, and then we're gonna walk to the next one, and then the next one, and the next one. So just remember, just because we're starting with one doesn't mean that we're not gonna get to the other four. We just want to start with the one first. And so it was a lot of back and forth, a lot of dialogue and discussion and consensus building. Well, first hearing what was important for everyone in the work group, and for the work group to agree, okay, we're gonna start with this one, and then we're gonna figure out what the next one might be. So instead of eating the elephant or boiling the ocean all at the same time, let's just start one at a time, and with the leg bone, the thigh bone, whatever it might be. And then with the understanding that we're gonna start with this one, and then we're gonna walk through to the next one thereafter. So that way, everyone has an understanding that we're gonna get to what's important to them, but also the understanding that we're gonna start with this one first.
And I agree about boiling the ocean, and you can do that. You just have to do it one cup at a time. And I think also you can work on the big P and the little p at the same time, because one kind of like feeds the other. You know, just for example, some days you're really into, as you can tell, we love flow charts and system maps, and you know, we're just so full of ourselves. Some days like, that's beautiful, it's beautiful. And then you go home. You know, just a quick story. I was at the Fed because I'm also a crazy cat lady in our neighborhood. And I was leaving, and there was like a woman who brought in her dog with her little girl who was injured. And then she was trying to get a signal so she could get an Uber to go to Sunnyside, which is very far away. And I looked at her, it's like, how are we helping these families? How do we speak to these families? And so the only way I knew how to speak to her was like, get in my car, get the dog in the car, get the kid, and the 5 Fiesta bags she had with her, because she also went grocery shopping. And you have no ride. And she goes, but I live way over there, I'll take you. And of course, I love it. She goes, you're not gonna kidnap me or anything. I'm like, no, trust me. I don't know what I'd ask for, but yes, just get in the car. And so I think that kind of work every day kind of like grounds that big P, right? And makes it, you can see that's plausible.
All right, well, thank you so much. That's all we have time for. Thank you so much. For giving me a great power of events today. We really appreciate it. And we are moving on to wrapping up.
Thanks. And thank you all for your contributions. So where are we gonna go together? Thank you, Sheila, for other places we'll go. I'm gonna do this quickly, but I want to reflect on this. This is a slide from Thomas Friedman's Thank You for Being Late book. And he wrote this about technology and the inflection point of human adaptability and how change was happening too fast for us to adapt. And so if you haven't read it, read it. But the only way to get there, to really catch up, is to learn faster and govern smarter. And to me, that so resonates to what we're doing here today. The speed of what's happening in our communities and health equity is happening so fast. Even just on the technology side, the technologies are coming out faster than we can learn, right? The only way we're going to bridge that gap is by coming together and doing things smarter. And that means the science of the system of working together. How does the work that we need to get done go faster and smarter because of the work of others in the room? And that is not easy, y'all. We talk about collaboration all day long. And what I've come to realize is we're not always on the same page of how we break down the definition of collaboration. And I particularly love this, but I'm not gonna read it out, and the difference between collaboration, coordination, and cooperation. I'm gonna focus there on the underlying part. Strategic, interdependent action. Making the choice that the work that I'm doing depends on the work that you're doing. Letting go of the control and the power of from this dot to that dot is what is going to get us there. That's our job. It's a choice every day, and that takes trust. The power of trust, the power of taking the time to invest in this. And trust is one of those really fuzzy things, right? Like, you know when it's there, but how do you create it if it's not? One of the recent definitions that I came across that really was, oh, I like that one. Trust is accountability and communication. Accountability and communication. Once you break it down to those two things, we can do that. We can be there for each other. And then we've got this beautiful wheel here of how do we cultivate that space? Acknowledging, I was at a conference in Austin this past weekend, and they were talking about the difference between distrust and mistrust. And how in some of these spaces, y'all, we found this in the CHW work, we're not starting from ground zero. It's in the negative end. And you've got to make investments there. You've got to make investments in healing and healing from inside out. This is happening in our organizations and it's happening in the individuals, and the pandemic did not help that part, y'all. So looking at those power dynamics and being very intentional. All of us are going through building new strategies in our organizations right now, being very intentional. Our organization does not need to do it all. UC Health doesn't need to do it all. We can partner with y'all who are already doing these pieces. And that's how we're doing it. Voila. Please take a moment to use this QR code. Hopefully this one hasn't already expired. I've heard the QR codes on the sheets have expired. We will fix the expirations and get them out to you. But this is an evaluation of the event here today. We're closing up here on time. We do encourage you, if you haven't already registered for the noon event, in the Nader lectureship, featuring Dr. Cynthia Osborne. She's going to go much more in depth in the work that she's doing. And I know many of you really care about the work on maternal and child health and policy. I also want to make a plug for our good friends. I don't know if they're here today at the Air Alliance, and Jen Hadaya and her team. Phenomenal work coming up on December 7th. We will have a shared event with their Alliance reports on our region and the impact on air pollution, on mortality. And it's going to look at some of the data, but it's also looking at the important things that we can do, because we know the days when the pollution is high, there are things we can do to save lives. And what are those actions and how do we get the word out? So let your providers know as well. You did it.
Everybody for taking the time to not just come here today, but for all of the incredible work that you have been engaged in, the work that we have done together. I get this question asked to me many times. You're a researcher. What are you doing with a coalition? And research does not happen in a vacuum. We would not be successful at our research if we did not have the infrastructure of this collective work together. So I hope each of you continue to see yourself in this work, and we look forward. If you want to join work groups or contribute, whatever way, however we can help you facilitate that, that's our goal. And that we can promise. We'll be there to help facilitate the work that you need to get done in this space. So thank you, everybody, for coming. Thank you. Oh, if you need parking, if you park for more than 2 hours and you need